I'm joined now by former Fox News correspondent Carl Cameron, co-founder of Front Page Live, and Dr. Natalie Azar. And we're going to get into all this. Carl, we just showed some footage from a hospital room. In your experience, do you think people are coming up with this stuff on their own, or do you think some of that rhetoric and framing is being echoed from some of what we hear at Fox?
Oh, I think it sure is. Whether it's Newsmax or the One America Network or Fox, cable's got a lot of disinformation coming out. And I think, frankly, some people in those organizations have begun to realize that it's completely irresponsible and it could lead to people's deaths to suggest that they don't need to get vaccinated. To the extent that there are some in Fox who continue to be, quote, anti-vaxxers, that really sort of diminishes the type of stuff that Sean Hannity did just a couple of days ago, which was a huge break from what we've been hearing from Fox from one of its top guys. So it's a step, but it's a baby step. And frankly, social media and cable TV have been a huge problem. And to some extent, you can't really trust who you're talking to with your neighbors because of social media and those other TV platforms.
Doctor, how do you deal with this from public health perspective? Because if you divide it up very simply and say there are people who have the right facts and they get vaccinated, and there are people who have the right facts and make an informed choice not to, I think those are two acceptable groups from a medical perspective, right? You get, your patients ultimately are in charge of their decisions. But we're talking about this other category. I see a third and fourth. Third is people who have the wrong information about the vaccines. That's about the safety. And then fourth is what we just showed, which is you're not even talking about whether the vaccine works. You're now talking about whether there's been an effort to encourage people to get it, which, as I analogize to seatbelts, there has. It's not sinister. It's for reasons. How do you deal with that for public health?
Yeah, well, look, I mean, certainly it's been surprising all along and unfortunate that COVID-19 as an infection and a pandemic, and then masks and now vaccines have just fell along this, political fault line. But unfortunately, that's the case. Look, I deal with this every day in my office. I usually end every encounter with, "Have you gotten the vaccine yet?" And if the patient says no, I sit down again, and we spend that extra 10 or 15 minutes engaging in the patient in a conversation. And it starts with, one of my first questions is, where do you get your information? And it absolutely is social media. It's, different newspapers and different communities. And I say, well, what sources are they citing? And just kind of really trying to get to, where people are getting their information. Because really, we spend a lot of time talking here on our network, but our audience has been listening to us the entire time, right? The trick is to get the folks who've been listening to the other networks and who are getting their information from those alternate sources to kind of get to them. And I think that that's really the challenge that we're facing right now. It's certainly the challenge that I feel, when I have patients. I had a pregnant patient this week and a patient who was immunocompromised, both of whom were really reluctant to get the vaccine for various different reasons, Ari, and it is a significant challenge.
Just to put a point on it, are you finding that sometimes they have misinformation from the media, and are you able to move them? Or does it become a kind of a screen or filter where their own doctor has trouble moving them? Obviously, without you, revealing anything about individual patients.
Right, exactly. Look, I mean, I'm very careful, and I start off every conversation with, that I respect their decision no matter what. And I really do want to understand what their concerns are. And some of them are absolutely valid. But many times we do hear, myths. And, a recent poll showed that 2/3 of people believe the myths that they read or hear about on social media, for example. So really what I do is I everything that I do, I try in my life as a physician and as a medical journalist. It's fact-based, it's evidence-based. That's always going to be their decision, but I want them, to make the most educated and informed decision that they can, just like we do with any sort of consent in medicine.